in my own clinics, because I'm a clinical immunologist and I am concerned about the immune activation, the antiviral function, and viral reactivation and so on, I do a lot of studies to look at which viruses are there, what the immune function's like, and I try to find therapies that are aimed either at those viruses or at that immune system problem. It's not super straightforward. We don't have you know, a recipe book yet for these types of disorders, but yeah, there are some very helpful things. So some of my advice seems stupid. It's like nutrition. Nutrition's not stupid though, because you're using up a lot of stuff. Your cells are turning over at twice the normal rate. You're immune activated. You got to make new cells constantly. You use up stuff, and you use up basic nutrients. When we do nutritional studies in chronic fatigue patients, we find you a little low. You're a little low in your B vitamins. Even when you're repleting, even when you're taking extra vitamins, we find B vitamins are low. We found minerals are low, particularly the minerals that are used by the immune system, selenium and zinc, that sort of thing. And so all of my patients are advised to take a very good, first, healthy diet. Why eat junk if healthy food's available? You know, don't eat garbage. Even though sweets and all the rest are very comforting and comfort foods make you feel better, it's a very short-term fix, and in the end they make you feel bad, fat and bad. So avoid the comfort foods. Try to fill up and stock up on foods that are good for you, that have some nutritional value, that would do more than just feed you. And then on top of that, some supplements, basic stuff. A good super B complex, some sublingual B12. Usually B12 comes mixed in with some B1, B6, that sort of thing. Harmless and potentially quite helpful. Then we get into areas that you might say, what's been tested? What's had placebo-controlled trials? What nutritional things have been tested in chronic fatigue syndrome? And there have been placebo-controlled trials to show some advantage of certain nutrients. Certainly the first one that was done was omega-3 fatty acids. Omega-3 fatty acids have some very nice advantages. They are anti-inflammatory, and you have a lot of inflammation. They enhance certain immune functions, so I kind of like them, because I'm, you know, you go immune system, go. So they have a tremendous anti-atherosclerosis potential in terms of prevention of heart disease and stroke. And since I'm a little worried about that, I throw that in too. There's been 2 or 3 placebo-controlled trials with omega-3s, and they did see some modest but real benefit, made people feel better. So at a range of around 4 grams a day or so of omega-3, be it fish oil or a vegetable source, it doesn't really, there have been studies of both, and they both were about the same. So that can be useful. Another thing that's had a study is CoQ10. CoQ10 is an antioxidant. Of all the antioxidants on the market, it's the one that absorbs the best, the one that actually gets inside the cell the best. So it's widely used, it's very popular, it's very easy to find. The Japanese study used 60 milligrams twice a day. They're little bitty people. I think that in America we supersize, so you might want to supersize your CoQ10 dose up appropriately. I tend to prescribe about 100 twice a day or 200 once a day, something like that. Again, that has only had 1 placebo-controlled study, but I think it was a good one, and I took it to heart in my prescribing practices. Other supplements that have had some clinical trials, there's something called NADH. It's something that increases the energy in a cell. They had a nice little study, placebo-controlled, only one, never went on to do the bigger, better studies, but they had one take-home point, and I take this to you in general about everything. If it worked in 30 days. And if it didn't work in 30 days, it didn't work. So there's some supplements out there where you might want to give it a try for 30 days, maybe 2 months, even 3 months. But if it hasn't worked in 3 months, if you haven't noticed a difference in how you feel in 3 months, you might want to dump that one, because at some point your box of supplements looks a lot like my kitchen cabinet of things I should have thrown away years ago, and it needs cleaning out. So what have I said here? I've talked about Omega-3 fatty acids is being your friend. B vitamins in general, and B1, B6, B12 in particular, your friends. Some minerals in there, so a good multi with minerals. Good friends there too. CoQ10 for its anti-fatiguing and its cell protective capacity. CoQ10 cleans up the stuff that can cause cancer in a cell. It cleans up something called free radicals. And in that sense, it's, at least theoretically, should be another cancer prevention agent. So that I think is a very reasonable set of supplements to promote. There are lots more. I mean, you could spend your days going through the Whole Foods catalog and trying to find the best supplements for you. But I think those are the only ones that actually have had placebo-controlled trials. There's some anecdotal stuff. People tell me that if they have a lot of muscle spasm, particularly Charlie horses at night, that magnesium is very helpful for them to prevent their muscle spasm, and that makes perfectly good sense. Magnesium should do that. Other minerals, potassium. If you're on a diuretic, oh, here's a tricky one. Licorice root. A lot of patients take licorice root because it acts like medicine that we prescribe, Florinef, which raises your blood pressure. And just like Florinef, a medicine we prescribe, it drops your potassium level down. And potassium, when it's low, feels just like chronic fatigue syndrome. Your muscles don't want to work, you're profoundly fatigued. And then you die, because the next thing that happens is you get a fatal arrhythmia and you die. So one of the things that really worries me in my patients is that they take supplements, things that I don't even know about, that could lower their potassium, and it's very, very dangerous. So watch out for licorice root. If you're taking licorice root, you should be getting some blood tests to check your potassium level. If you're on Florinef because your doctor prescribed it, you should be getting potassium levels checked for the same reason. In other words, those over-the-counter supplements are not innocuous. They actually can do harm, not just good. So be careful, and that they could be very dangerous.